Hi, it's Jerry Roberts back with another edition of Newsmakers Pandemic TV. And today we're joined by Tyler Hayden, a reporter for the Santa Barbara Independent, who has filed a series of exclusive reports about what is going on inside the Lompoc federal prison. Tyler, thanks for being with us.
Thanks for having me.
So what's the latest? There's 2,700 inmates, is that right, about at the prison?
Yeah, there's about that many spread between the low security and the medium security facilities there. They call it the Lompoc prison complex because there's two distinct prisons. But yeah, there's about 2,700 inmates there. And as of last count, there's been about 1,100, 1,200 infections total. Between both the inmates and staff.
And how many deaths?
4 deaths as of today. The most recent one took place earlier this week. It was a person who had been sick for a while, been on a respirator, taken to a local hospital, and then ultimately passed away.
So really, I mean, that's sort of the center in terms of Santa Barbara County, of what's happening with the pandemic to a certain extent. Why has it been so hard to get information? I know 2 U.S. senators and our congressmen and everybody have been trying. And why has it been so hard? And how have you been getting information out of their prison?
Yeah, I didn't realize this until I started reporting on what's going on there. But I guess the Bureau of Prisons, the federal agency that runs federal prisons, they are famously secretive, non-transparent, not willing to talk about their operations, what's happening inside their facilities, not just with the public and with the press, but as we've seen with members of Congress as well. So I've been in contact with one of their spokespeople. He kind of just gives me canned, basic answers, sort of the party line about they're doing the best they can, and there's how proud they are of staff and all the correctional officers who are working through these conditions. But mainly, I've been getting my information directly from the prisoners themselves, who have been writing letters, and then talking to family members who have been in touch with them. So that's where we're getting sort of most of our firsthand knowledge and reports of what's going on there, because the prison won't, as I said, say anything beyond just that sort of prepared remarks that don't say anything.
So this is something that's been sort of an issue with the Bureau of Prisons previously. This is not just a Trump thing.
No, I guess for a long time there's been concern in Washington just about their operations, their lack of cooperation, coordination, communication. And it was a couple of weeks ago that a Republican senator, there's this concern on both sides of the aisle. This isn't a Democratic anti-Trump thing. This is been pretty widespread criticism of the agency. And so a Republican senator a couple of weeks ago introduced legislation that would make it so that the next Bureau of Prison director would have to be vetted and approved by the Senate, as opposed to just being appointed by the Attorney General, because they've been so displeased with the guy who's running it now, this career BOP guy, Bureau of Prisons guy named Michael Carvajal.
As opposed to Carbajal.
Yeah, Carvajal with a V, yeah. And he actually, I mean, I will say he didn't perform so great when he was in front of the Senate Judiciary Committee earlier this week. He just as an observer, he seemed pretty unprepared, kind of defensive, deflective of both the Democratic senators' questions and Republicans as well. And he got admonished by the end by Senator Lindsey Graham, who said, let me give you some advice. The next time you show up to one of these hearings, if you have a federal case out of Connecticut, you should expect the senator from Connecticut to ask you about it, in reference to Blumenthal asking him about this pretty major court order to basically for the BOP to clean up their act and start taking care of their staff and inmates better.
All right. I want to talk about some of the cases with the prisoners and the Eighth Amendment and things like that. But just in terms of how this situation is affecting the community, the broader community. Are cases, because there are so many and more deaths there than elsewhere in the county, are they using community hospitals and medical facilities?
They are. They have been since the beginning of this. Our local health officials were surprised pretty early on that the prison complex really didn't have anything beyond like a basic doctor's office, just kind of a small medical bay. So even before COVID, they relied on local hospitals, mainly Lompoc Valley Medical Center, and then Cottage Hospital, sometimes for more serious cases, for all of their healthcare needs, essentially. So during this, when prisoners have gotten really sick, they've been in our local hospitals under guard 24 hours a day. A couple guards changing shifts. Earlier on, that was a concern among the healthcare professionals, the doctors, the nurses who would take care of these patients. They would see, because in these very tightly controlled, tightly monitored facilities, I mean, these hospital wings, the guards were coming in and out without protective gear. They weren't wearing masks. The doctors didn't have a lot of authority to tell them what to do. So there's some tension there. I think that's gotten smoothed out somewhat, but there still remains sort of the lingering concern that a lot of our resources for extremely sick COVID patients are going to prisoners. Not that they shouldn't get medical care, but that it could potentially, detract from caring for residents of the county. We haven't seen that play out in the dramatic way that there was concern of a few weeks ago. But it's an interesting dynamic to have been witnessing this whole time.
And the Bureau and the prison itself are being secretive even about that, about how much.
Yeah, so at first our local health officials were saying how many prisoners were in hospitals, how many were on ventilators, where they were. I take that back. They weren't saying where specifically they were. They were just saying they were in community hospitals. But that was even too much for the Bureau of Prisons. They claimed that there was security concerns and that they didn't want to tip off anybody who might want to hurt an inmate, someone from the outside who could potentially go into the hospital and cause some trouble. I mean, I suppose there's some credence to that, and it makes sense why they would want to be careful about not disclosing the inmate's name or exactly where they were. But they were never doing that, and they shut down our county officials pretty quickly from disclosing that information. Though I have been able to get it again more recently from Salud Carvajal's office, because they're getting briefings directly from the BOP.
And then the other piece of it would be the staff, people working in the prison who go back and forth to the community. What's the status of that?
I mean, it's hard not to draw a line between the fact that there's more cases in Santa Maria and Lompoc and surrounding North County communities where the majority of prison staff live than there are in South County, like disproportionately so. So I'm trying to get a handle on right now how many staff who work at the prison live in Santa Maria, how many live in Lompoc. I don't need names. I don't need whether they're sick or not. I'm just trying to figure out where they geographically live to see if there is some kind of correlation between these pretty significant spikes in cases in North County cities and communities. Like Santa Maria is off the charts comparatively speaking to the rest of the county. And I know a lot of staff live there. So we don't have sort of any definitive proof yet, but we don't have to work too hard to connect the dots to kind of see that there might be some connection there. And I know there's a lot of staff that have been doing everything they can to follow protocol and to be safe. But then we've also heard from a lot of inmates that staff weren't wearing masks at first, even though they were supposed to. When inmates were making their own masks early on in the pandemic, they just took it upon themselves to protect themselves and the other inmates. They were admonished by guards to not make their own masks or wear their own masks. I mean, they were using, like t-shirts and bandanas, and guards would come up to them and say, you need to take that off or I'm going to write you up. So we've heard quite a bit about that. Some guards not taking it seriously and seemingly to kind of like actively disregard the potential risk.
So did the public health officials, either on the record or off the record, see a connection between the staff and the overwhelming portion of cases in North
They,
County?
they say they're looking into it. Off the record, they say, yeah, I think we're going to find that there's some connection there, but they haven't so far, said openly like, yeah, we're pretty sure we know what's going on. I mean, Dr. Henning Ansord, our health officer, at a recent press conference, just kind of shrugged his shoulders and said, well, we're still looking at the data. So, and the paper is too, we're putting in FOIA requests and Public Records Act requests to try to get some of that information.
Yeah, I think one of the more dystopian things, and try to put yourself in the place of someone who's incarcerated, what a nightmare, is they kind of cut off communications. They shut everything down. What was that about? Or is it still ongoing?
Yeah, it's still ongoing. It's less restrictive than it was for a little while there. So about a month ago, 6 weeks ago, they, as actually right after inmates started contacting the paper, and I started talking to family members, and quotes started appearing in the paper, and the BOP all of a sudden wasn't starting to look so good, they implemented a hardcore lockdown of all inmates throughout both facilities, where they weren't allowed access to email or phones, which would have been their normal form of communication, checking with family every day or so. So they were completely kept away from that, under the pretenses that they didn't want them congregating in any one place and potentially spreading the virus, which is sort of silly because they all live together and tightly packed.
Yeah, what are the conditions?
So the layout for at FCI Lompoc, which is where most of the cases we've seen, is kind of open dorm style living conditions. So they're bunks, 2 or 3 high, and basically big giant rooms. And so when these guys are on lockdown, they're not allowed to go outside. They're not allowed to use the phones or computers, as I said. They're not allowed to work out outside, go for walks, get fresh air. They're just kept in one, basically, or a couple large rooms. There's a few gymnasium style settings where they're in. So the cutoff of communication and the reason for doing so never really it didn't sit well with them, obviously, and it didn't the reasons for it didn't seem super truthful from the BOP. They've since eased those restrictions, so guys can now call out again, at least, and are emailing family members. For a while, even their mail was getting confiscated. I thought maybe the most telling thing from all this was the USA Today put out a pretty scathing op-ed a couple weeks ago about the Bureau of Prisons, just saying how poorly run it was, how they're not obeying their own orders from their own boss, basically Attorney General Barr, saying you need to release as many inmates as possible to hold confinement, to help people social distance. So there's this long op-ed, and a lot of inmates subscribe to USA Today. That's how they get sort of their national news. And then that particular day, the paper didn't get distributed. No one saw it. And that had happened, I guess, a couple times. Anytime there had been an article about a death or a lawsuit, not just here, but across the country, because this isn't the only place this is happening. There's a lot of issues in a lot of places. We happen to be one of the worst as far as infection rates go, but they operated in a vacuum, seemingly, and that's why not only families and inmates, but senators are trying to crack that open a little bit.
So I imagine that you've become a popular fellow in terms of families reaching out, because they're kind of got a deaf ear everywhere else they turn. What describe what that's like?
Yeah, it's been an interesting and challenging reporting process through all this. Earlier on, when families were getting zero information from their relatives, the Bureau of Prisons weren't returning their calls, their lawyers didn't know anything, and so they didn't know if their dad, husband, brother, if they were sick, alive, in the hospital, recently died. They didn't know anything. So for a while there, I was like their only point of contact So I, for a while, was feeling kind of like a social worker almost, like kind of having to explain the situation as best as I understood it. Explain to them I couldn't be an advocate for them. I couldn't, file a lawsuit or start a GoFundMe page or start a petition. That I was happy to tell their stories and expose what was going on so that people with subpoena power and legislative power could maybe take action. But there's a lot of just listening to people, hearing people cry, hearing people semi and sometimes completely hysterical about what was going on with worry and concern for their relatives. So that was different, and it was weeks of it, because they didn't know anything for weeks, and I became the person who probably knew the most just by talking to our local officials and getting bits of information here and there, and it's still happening. I recently I got a form of communication from an inmate that would probably get them in trouble, but they're still trying to reach out and get the truth out there because they're pissed off and concerned and scared for their safety.
Has that been a different experience for you just as a journalist reporting on this particular story than in others? I know, obviously you've reported on disasters and victims and things like that before.
Yeah.
But it just seems like you got a lot of emotion unloaded on you.
Yeah, I did. And that was okay. A lot of people I feel like just needed to be heard, they just needed to get someone on the other end of the line who knew something and cared about what was going on. But yeah, that was different. I mean, I've had versions of that with, as you said, isolated stories or incidents here and there, but the volume of calls and emails I was getting, the amount of time I was spending on the phone, the duration of it, as I said, it's tapered off now because at least there's some communication on the inside. But yeah, that was, I should probably get some therapy after that. 'Cause it was a lot.
I actually thought that before the story, but that's
yeah, definitely now.
So just take a step back though. Here you got two U.S. senators, Dianne Feinstein, Kamala Harris, plus our congressman, Representative Carvajal, and they keep writing these letters and trying to get information and having hearings, and they're like getting shut out. It's rather extraordinary, is it not?
I think so. I was actually going to ask you because you've covered, state and federal politics more than I have. And it struck me as bizarre and unusual that the people at the highest level of power in our government can't get basic information from a government agency. I just don't quite understand it. I guess they can go the legal route. But no, it seems really strange to me. It seems like it speaks to a little bit of a broken system we have in this respect. If like the oversight committee can't conduct oversight because they don't have information and data to look at and to drill down into, and they have the director basically saying, oh yeah, I can maybe get that information for you, when he knew this hearing, was coming up, was scheduled, but like clearly didn't do any of his homework. It's strange. It's really strange. I've been struck by it. And so, is it unusual in your experience too?
Well, honestly, I've never really covered much with the Bureau of Prisons, but I don't doubt what you say is sort of, a systemic issue of getting information out of them. But I also imagine, that, Trump has kind of made it a badge of honor that they're not going to cooperate with the legislature, with the congressional branch, particularly with anything to do with Democrats. And the numbers aren't good. It's not making them look good. So
no,
it just
yeah, and it's not just the numbers too. It's the stories that I've heard from these prisoners who've been neglected and just left in their bed to suffer and sometimes die. That's happening here. You hear about the woman in Texas who was arrested on a low-level drug charge while pregnant, got sick, had a cesarean section on a ventilator and died. And she was denied home confinement when So let me back up a little bit. A lot of this goes back to an order that Attorney General Barr gave in April across all 122 BOP facilities, that they needed to release as many low-risk offenders as possible who either had served a lot of their sentences or were, or just they did a complicated format to determine who was low risk. But he said, you need to figure out who these people are, and you need to get them out of prison so that we can quarantine properly, we can separate people properly, we can enact as much social distancing as possible that's possible in a prison setting. And what the ACLU has sued over and what these legislators are concerned about is that doesn't seem to have happened, that they've only released 2% of less than 2% of their inmate population to home confinement, when it's estimated that about 20% qualify for home confinement under these terms that he laid out. So it's like, why, what's going on there?
Yeah. So do you think it's mostly incompetence, do you think?
Yeah, it's a question I've asked myself a bunch. I think it's a combination of incompetence, bad leadership. I know here in Lompoc, we're on our 4th warden this year. So there's not a lot of institutional knowledge or experience. So I think it's incompetence. I think it's just bad communication, disorganized system, and then maybe just like willful obstruction of carrying out an order, though I don't know why, because Barr's, a Trump guy and Carvajal's a Trump guy. Maybe they just don't feel like the prisoners deserve it. That, they're very law and order.
Yeah, that's what I wondered. I mean, there's sort of these invisible classes of people now, me being one, being 71 and immunocompromised. I'm not getting out till there's a vaccine. And I'm one of the guys that typically it's, put them on an ice floe,
Right.
They were old and had underlying conditions, but prisoners, I mean, it really goes to that invisibility thing, because I'm sure that you hear from people, what's the big deal with the prisoners? It's kind of like they deserve it or something.
Right. Oh yeah. I've definitely gotten some of that, and you read our Facebook comments and there's a fair amount of that sentiment on there. But that goes to the 8th Amendment that you brought up, and the protections that we afford even prisoners, that we even though they're in prison, they're entitled to fair, safe, and humane conditions, and protection from cruel and unusual punishment, even if that punishment, is not the kind that maybe we would think of that amendment protects against, like torture or solitary confinement for too long, but clearly neglecting someone who's super sick and letting them sort of wallow in their own illness.
And plus, Trump's campaign guys who were in prison, they're all got out right away.
So. Right. Yeah. Michael Cohen and Manafort and a lot of other white collar prisoners. A lot of the parents in the LA admission scandal, a lot of them are out. So it doesn't seem very fair how they're conducting those assessments and releases.
You mentioned this, the Senate committee hearing the other day about the whole issue about what's going on. And that's obviously taking place against the backdrop of the protests and riots and concerns about structural racism. And did that issue surface? Was that like a big theme of the hearing?
Yeah, that came up again and again. A lot of the senators kind of couched their comments with that, and I thought Cory Booker was the most eloquent, and Kamala Harris too. Even they basically saying, this highlights the fact that there's two systems of justice in this country, and we know that people of color get longer and harsher sentences than their white counterparts who have committed the same crime, and we're seeing that in this process that the BOP is supposed to be doing objectively and fairly and based on science and the penal code, but as Cory Booker put out, the their own numbers suggest that only 7% of Black inmates are considered low risk, while 30% of white inmates are considered low risk. So there's just plenty of examples of that disparity playing out now. And I'm curious if that's something we've seen here in Lompoc. What medical care prisoners have been seeing, and if there's any disparity between white prisoners and Latino and Black prisoners. I don't know yet, but I think that's something.
So have you got a lot of FOIA requests, a lot of Freedom of Information Act requests going?
Yeah, I got a couple of them pending. I'm going to file a Public Records Act request with the county also, because I'm curious about their interaction with the Bureau of Prisons. I mean, I think basically from the beginning they've been shut out of the prison operations. They've offered to help, they've wanted to coordinate, but from what I understand, they've basically just been told to go away and keep quiet, that the BOP doesn't want their help. But I am curious how and why early on in all this, the county was saying the exact opposite. You had a guy from the Office of Emergency Services, and he said during the press conference, they are wonderful partners. We love working with them. They're the greatest. I think he even used the word like astonishing, like we have an astonishingly good relationship. So clearly that was all
astounding partnership.
There you go. So like clearly that was all BS. And I'm curious what the strategy was there. Were they still trying to play nice with the BOP so that they could, actually get stuff done, or I don't know. So that's what I want to find out with the PRO.
Yeah, it's interesting. I've had Greg Supervisor Hart a couple of times and asked him about this, and you could tell, you could kind of see the wheels turning and the 7-second tape delay before he'd say something.
What has he said? I should know, but what has he said to you?
Well, first he said, basically just very flatly and neutrally, we're having a hard time. The second time, a couple weeks later, he started to say something, and then he said, things are beginning to get better. And it was shortly after that there was a little turning of it based on your reporting of it. Yeah. All right. Well, listen, what we're supposed to do as journalists is afflict the comfortable and comfort the afflicted. And nobody's more afflicted than these guys that you're reporting on, and you're doing the Lord's work there. And I know he had a little piece in the on the website a couple of weeks ago about subscriptions, and of course the independent, along with every other small business, is hurting during this. What's the deal with the subscriptions once more?
If you want full access to the site, though I will say all of our COVID-related news, all breaking and public safety news is always going to be free and available. But if you want full access to the site, the subscription fee is $29.99. You get a lot of bang for your buck. You get all of our arts and living and sports, all of our coverage. So that's the first avenue of supporting the paper. But people can also donate as well, either straight to the paper or through SB Can. So there's multiple avenues to do it. And I will say, reporting out this story and seeing the effect that it's had, because I've actually heard from, I don't like to toot my horn, but this was a case of like being able to see pretty quick change happening from putting out these stories. Is, we would put out a piece and we would say, for instance, that the guys were being housed temporarily in an abandoned building that had black mold contamination, right? We heard that a couple times. After that story came out, I heard from a week later from one of the inmates, they actually moved us out of that dorm because they read your piece and they got freaked out about lawsuits. So moments like that really underscore what we do and why we do it, and the difference it can make. A lot of our reporting was cited in the ACLU lawsuit that came out. I didn't write the pieces for the ACLU, but they used what we discovered and what we uncovered to support some of their arguments. So that shows too that these types of pieces, which take a lot of time, a lot of reporting, a lot of manpower, how valuable they are and how we as a community need it, and we need people's help to continue it.
All right. Yeah, Tyler, thanks a lot. really had a lot of impact. And if you haven't checked out Tyler's stuff, you really do. I mean, this is a national story. It's a big national story, and he's kind of been out there all on his own reporting this. I think the LA Times has had maybe one or two stories, and so really great enterprise and investigative stuff.
Thank you.
Keep going. All right,
Yep,
thanks, man. Thanks for being with us.
Thank you. Good being here.